Welcome to A Journey of Triumph, the podcast where we share inspiring stories of resilience and triumph over life's toughest challenges. I'm your host, Dr. Loh Chai Ling, and today we have an incredibly special guest with us. Joining us is Dr. Lam Ying Keat, a dedicated dentist at Smileworks and a breast cancer survivor. In today's episode, we will delve in Dr. Lam's inspiring journey, her battle with breast cancer, and how she emerged victorious. Our goal is to empower women who are walking the same journey to find hope and encouragement from Dr. Lam's fight and triumph over the disease. Please join me in welcoming Dr. Lam Ying Keat as we explore her journey of courage and resilience. Welcome to the show, Dr. Lam. Ying Keat, actually, you may not. I mean, we've gone back quite a long time, like 30 years, right? We were what, secondary school classmates, Sec 3 and 4? Mm-hmm. I mean, from that time until now, I think you haven't really changed. You still look about the same.
Only my hair is white lah.
But nice white, you know. I'm sure a lot of people want to know, what made you become a dentist?
Me?
Yeah, I didn't realize that you wanted to be a dentist when we were in secondary school together.
Actually, there was never... I never thought of being a dentist.
Oh, is it?
Yeah, I mean, our class is all want to become doctors, one, right?
Yeah lah, I want to be.
Yeah. So of course, then I applied for medical school.
Yeah.
But I don't know whether you remember at our time, actually, because I'm Malaysian, so they had a restriction on Malaysian females to go into NUS medical school.
Okay. Yeah.
So cannot get in, right?
Yeah.
In NUS medical school. So I applied overseas, but unfortunately my family couldn't afford to send me overseas.
Yeah, okay.
So then actually dentistry found me.
Ah, okay.
So it's just like, you just had to put second choice, right?
Yes.
So it became second choice.
Yeah.
But I got it. But then on hindsight,
Yeah.
it's a true blessing. Because it turns out that actually, I feel, right, I'm much happier in dentistry, and I found I really enjoy doing it, and because it's a very hands-on kind of thing. Everything is hands-on, you know, it's surgical, and I realized I like to work with my hands. You know the irony, I was always wanted to be a gynae. So I ended up the other side, no?
Right.
You know?
The head, not down there, right?
Yeah.
So no regrets lah.
No regrets,
Okay.
no regrets. I feel that, and I mean, after that, at that point of time, at the end of the day, we just make the best of whatever it was.
Yeah.
But it turned out to be actually the best thing ever.
Wow.
It turned out to be a blessing.
That's amazing. So know, now that you're a dentist, maybe you can give me, my patients and my kids some advice, because we don't know much about the teeth, but there's always all these myths, right? So a lot of my patients ask me, is it true after you drink red wine or orange juice, you cannot brush your teeth?
Immediately. Yeah. Actually, the acidity in our food can affect the teeth.
Okay.
Right? Be it tooth decay or erosion in the teeth.
I see.
So, acidic things like is it orange juice or red wine or things like that, when you put it in the mouth, you don't want to immediately go and brush your teeth because there's the acid in the mouth that you're using to actually go around the teeth.
Right.
So what we do is actually, what counteracts it is the saliva.
Oh, okay.
So we generally advise people to wait at least half an hour because the saliva is alkaline. It tends to buffer the acidity, so that at least the pH in the environment in the mouth is better. Then only you brush your teeth.
So no brushing the teeth immediately after food. You want to wait for a while?
Immediately after the acidic stuff.
Acidic stuff. Okay, so like orange juice and wine.
Yeah, a lot of the wine. Yeah.
Okay.
Yeah.
Then some people tell me not to use mouthwash. I've used to use a lot of mouthwash, so it's like flossing, mouthwash, brushing. Is that wrong?
Okay, you floss, I say very good already. Because a majority of people don't floss one,
Oh, is it?
Okay.
Difficult lah.
No, it's also a habit, it's a discipline.
Yeah.
But mouthwash, honestly, I only tell my patients to use it if they really need to. Basically, either they really need to kill some bacteria, so antibacterial ones, or the tooth decay risk is extremely high, then the fluoridated ones.
I see.
But majority of times, I find that without is fine.
Okay.
And because some people, they tend to get a lot of stains with mouthwashes.
Oh, can mouthwash stain your teeth?
Yes, some. But having the same kind of mouthwash in different individuals, some people have no stains, some people have a lot of stains.
I see.
So but if I can find a person who can really clean well and floss well, actually I feel that is sufficient.
So how many times a day is sufficient? And how long do we spend brushing my teeth? I mean, because when I brush it may not be long enough, right?
Long enough is one thing lah. Whether the technique is correct, that's the more important one.
I see.
So at least morning and night, right? But duration generally is about 2 minutes.
Okay.
But I've seen people who brush longer, but
Yeah.
technique is wrong. You still miss out on the important.
Okay.
I mean, they don't clean from the gum line.
Ah,
The moment
okay.
you miss that out, then you have a chance of gum disease.
So you're not really cleaning the teeth. You're actually cleaning the transition between gums and teeth only, is it?
Teeth and that gum
that-
line and
oh,
the
the gum
transition
line.
between the gums and the
I
teeth.
see.
It has
So
to be.
will the normal toothbrush be enough? When you talk about 2 minutes, is it normal toothbrush or ultrasonic or electric? Now there are so many on the market. Is
Yeah.
it more expensive, the better?
Okay, so
Yeah.
so that's the interesting thing, right?
Yeah.
They found if you know how to do it correctly,
Yeah.
just the normal toothbrush is enough.
Okay.
So how they did a study, right?
Yeah.
And they realized that dental care professionals like me, right? I can just use a regular toothbrush
Yeah.
and I can be very effective because I know exactly what I'm supposed to do.
Right, okay.
But if a person doesn't really know what to do,
Yeah.
then they might miss out quite a lot of things.
Yes.
And then sometimes the electric toothbrush can be more useful.
I see.
But having said that, I've also seen people use electric toothbrush and don't use it properly. They don't put it at the correct place or not long enough because they just go back and forth, like that. Versus like holding it one tooth at a time.
Okay.
So it still boils down to
I see.
using it correctly.
Yeah, so it's the tools, but you have to use it correctly. But you
Yeah.
know what is this I hear nowadays? People saying that fluoride is bad. Is this just something that is real or trending?
I mean, fluoride in high amounts in the human body,
Okay.
of course, it has toxicity.
Yes.
Right. But at the same time, fluoride in the correct managed amounts
Yeah.
have its benefits.
Okay.
So we have to weigh those two,
Yeah.
lah. But
Yes.
nowadays, there are people who go to the extreme
Yeah,
end.
no
and-
fluoride,
Yeah.
Yeah.
So we have to weigh out the.
So is the dose makes the poison. So if we're just using fluoride to brush our teeth, it should be okay. Morning and night.
the
Yeah.
doses are the doses are controlled actually.
Yeah. Okay. So a fluorinated toothpaste, you think that's not a problem at all?
No.
Okay. Right.
Yeah, but different people have different schools
Again,
of thought.
yeah. So coming back to you, I think you have gone through such an interesting journey. I remember when you were in secondary school, you were always this very fit, healthy, and you were definitely more like a leader and very optimistic. And I've heard in the past years, you actually went through a little bit of a struggle. Could you tell us a little bit more about it, your health issues in the past few years?
So I was diagnosed with breast cancer,
Okay.
stage 1.
When was that diagnosis?
And this is the most amazing thing, Chai Ling. Today
Yeah.
is the 2nd year anniversary of my cancer diagnosis.
Oh my goodness.
Because I have it in my calendar, right?
Right.
So in the morning,
2 years.
it beep like, so today is
So
the day.
today, happy breast
Happy
cancer anniversary.
So today is the day that I went to see the breast surgeon
Right.
with the pathology results.
I see.
Yeah,
Oh my
exactly
goodness.
2 years ago.
Right. Okay.
Yeah, it's
That's crazy. Okay.
It's crazy when I saw the
Synchronicity.
yeah. I mean,
Was it a shock when you were first diagnosed 2 years ago?
was it a shock?
And how did you even go and find?
Okay,
Did you
so
have a lump?
actually
Yeah.
the thing is that breast cancer history has always been in my family,
Okay.
both mother and father side. So my aunts, total of 4 of them had breast cancer. So I always felt that maybe I had a risk of it, even though my mom didn't have. So I always go and check. So in 2018, I actually went for a biopsy already, once. Then it was clear. Then 2019, check, nothing wrong. Then 2020, COVID. So because of COVID, then lazy, never go and check, right? Which is the usual thing.
Yes.
So procrastinated. Then one of my friends got diagnosed with thyroid cancer.
I see.
My age. Because of that, I thought, okay, this is a wake up call. I think to be on the safe side,
Yeah.
to go and check again.
Yeah.
So I did full body check,
Okay.
blood test, everything turned out fine.
Yeah.
Then one of my doctor friends said, hey, don't forget mammogram. So I said, okay, go mammogram. But because I have done the biopsy before,
Yeah.
my breast surgeon had always told me, look, your breast tissues are very dense, so you
Yes.
should go and do a 3D one. It's more accurate for you.
Okay.
So I went for a 3D mammo, 3D ultrasound. So during that process, the ultrasound process, they have the technician trying to do it for me, right? And I could see she was like, going again, the
Right.
same place again. Then I was
I
thinking, then I asked her, is there something wrong? The doctor will speak to you. So I was like, okay. So I was going on. So I was like, okay, fine, you know.
Yeah.
So it kind of like, you know,
Yeah.
gave me some inkling.
Yeah.
Then of course, then I was called up and said, okay, I know there's something there. You know,
Yeah.
we're going to do a biopsy.
Yeah.
So then the biopsy was taken.
Yeah.
So the previous time when I did the biopsy, 2018, when the biopsy results came out, the breast surgeon actually quickly called me and said, "Hey, you can don't worry, you can, you know, I know I'm going to see you in a few days time, but at least I tell you nothing, so you can have a good restful weekend."
Yes, yes.
But this time never leh.
I see.
So this time I was like, how come she never called me? Wait for me to go on that morning. It was a Monday morning to go there.
Yeah.
And then when I went in, then she looked at me, she said, yeah, like that. Then I was like, oh, you know, because I kind of half guessed already, right?
Yeah. But
So
how serious was it by then? Did she stage you?
there was actually still a lot of tests to be done, because after that, there was a whole load of tests of MRI lah, PET scan lah, you know. So how did I feel at that time? Of course, a bit of disbelief, a little bit shocked.
Like, how can it happen to me, right?
I won't say how can it happen to me. It's like it's happened to me. You know, but honestly, it takes a bit of time to sink in.
Okay.
It did take some time to sink in, but because after that, immediately post-diagnosis, there was just like tests up straight away. I was sent for PET scans, CTs. There was no time to think.
Yeah.
You know, but then immediately also it was interesting.
Yeah.
When I went, immediately they said, "Hey, I can get you the appointment now. You should go for this." I said, "Okay, let's go for this dude now, right?"
Yeah.
And straight away when I went there already, oh, there's a cancer patient. So suddenly I got labeled as a cancer patient right away. So having all these things like
being labeled, that's
sink
also
in. Right, because it didn't sink in for a while.
I mean, I totally get that. You know, we always think of ourselves as normal, and then when people say cancer patient, it's always somebody else. So when you suddenly get a label, it's like, is that me? That is quite scary. Then, how long did it take to sink in? Because by that time, you're still so busy doing all these things. So like, you know, it took some time before you felt.
Yeah. So of course it didn't. Actually, it did take a while. So I didn't tell my family until I was quite clear of actually what my steps were going to be.
Okay.
My next moves, right?
Yeah.
So it did take some time to sink in. So of course I went to gather all the do all the tests,
the results,
and then I call my doctor friends. I called Yenny. First person I called Yenny. Hey, then she called me back. You know. And then like what are the steps to do lah?
Yes.
Yeah. So it was more focused on that at that time.
Right.
I didn't know how to. In the first maybe 1-2 weeks, I didn't even know how to tell the people around me.
Yeah, I think I would have problems telling the people around me. I don't want them to worry, but I want them to know.
Yeah, because I also didn't know how to share that, and also I also needed time to.
Yeah. When did you eventually tell the people around you?
Okay, my parents, I kept it for as long as I could.
I understand.
Until, and I had to go for surgery.
Okay.
I had to give them a bit of lead time, maybe a week before surgery.
I see.
Yeah,
okay.
Rather than the day before surgery, right? At least a bit of lead time. But because there was so many tests going on, and and so I didn't want them to worry throughout that whole period of me going through those tests as well.
Yeah. But between your diagnosis and surgery, how long was it?
Okay, this one, right? Yeah. So because stage 1.
Yeah.
So first step is they wanted to say it's still relatively small.
Yeah.
At that point of time, it was still like they claim it was like 1 point something cm. Okay. So go and do a lumpectomy. That was because it's small enough for that, and radiotherapy.
Yeah.
But at the same time, we also did blood tests and for genetic testing.
Okay.
One day before my surgery, my breast surgeon calls me and says, "Your genetic testing results are out."
Is that the BCRA thing? No, is it a different one?
BRCA, the one.
BRCA.
Yeah, no, but BRCA and a whole lot of other, a few other genes that they test for, right? Then, so she said, "Please come back." So I know, please come back means something lah. Okay, so please come back, right? Yeah. So I went in, then she says, "You test positive of 2 genes leh. It's not the BRCA gene, it's a RED51 and something, a BRIP something lah. Okay, puts you at higher risk of breast and ovarian cancer."
Okay.
So then my breast surgeon said, maybe based on this, you have a higher recurrence rate. What I felt comfortable was, to just get second opinion. So I also went to seek second opinion.
Yeah.
And the second opinion doctors also gave me the same advice.
Okay.
So because of the surgery, suddenly instead of just lumpectomy, actually the doctors were recommending mastectomy and double mastectomy on both sides.
Both sides, okay.
Yeah, because my chance of recurrence was more than 40%.
Wow.
So I'm thinking 40% means like nearly like tossing a coin.
It's
you
like
know?
tossing a coin.
It's like tossing a coin,
Yeah.
right? So,
Yeah.
and already I'm cancer positive, right?
Yes.
So of course, my aim was always to get rid of the
Yeah.
disease and
Yes.
reduce my risk of recurrence as best as I can.
Yes.
Yeah, so because of that, then the surgery was further prolonged because after that, the whole host of treatment choices completely opened up.
Right. So you mean even though the treatment was mastectomy, there was still a lot of other various options? I thought.
Okay, so there was a lot of other various options because obviously I could still choose to go for a lumpectomy.
Right.
Then I could choose to only take up one side and leave the other.
Okay.
Then I can choose to take up both sides. And then because I have a risk of ovarian cancer, I can also choose to take out my ovaries. And then after taking out, you have the choice of whether you want reconstruction or not.
Oh my goodness, there's
So there's
many
so
options.
many things to think about. Like suddenly, right?
Yeah.
It's like so many things you have to think about, you know?
Yeah.
And then you're also concerned about recovery. There's a lot of
Yeah.
unknowns, and
Yeah.
there's so many things to think about.
Yeah.
Then suddenly, from seeing the breast surgeon, I was seeing the gynae, I was seeing the recon,
Yeah.
the plastic surgeon.
Wow.
It was like, you know, going from
And you already actually have a lot of medical knowledge, and I know all our classmates are doctors. So can you imagine if somebody don't even have this support group?
Yes.
It would be very overwhelming, you
It
know?
is overwhelming. It's overwhelming.
Yeah.
Yeah. And then at the same time, even though I have some medical knowledge, but
Yeah.
it's still so much things that I never knew.
Yes.
And the options, like even like surgical options, I have
Yeah.
to, I have to discuss with the reconstructive surgeon.
Yeah.
There's so many options as well.
I know, yeah, yeah. But we do reconstruction also, and at our clinic, I know that there are many options for these breast cancer patients.
Yeah.
But one question, just to sidetrack a bit. So you know, you talk about the genetic testing. Well, can a woman do that even before breast cancer diagnosis to see if they actually have the genes? Isn't that what Angelina Jolie did? I remember she
I think-
tested for the
yeah.
BRCA gene. She
Yeah.
actually had double mastectomy, even though she didn't have breast cancer then. Yeah.
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 So there are people who go for such tests. But then I think the main thing is, what do you do with such a result?
Yeah. Are you willing to take the steps after
no,
to...
some people, will it make you mentally worse off?
Yeah.
Mentally and emotionally worse off?
Yeah, like anticipating a bad outcome.
Or the worry. And then for some people, because they have kids, the impact on the kids, right? Then you
Yeah.
start worrying about your kids. You know,
Yeah.
that pass them the genes. So I think there's quite a lot of things. So some people I know, they just don't want to know.
Yeah. Okay.
Yeah, but for me, because of the diagnosis,
Yeah.
I think that genetic testing was very crucial for how I decided on my treatment option.
Okay. Yeah.
That to me was the important part.
Yeah. I mean, actually knowing your character, I almost can guess what treatment option you went for. But why don't you tell us what did you choose in the end? I mean, there's so many options: lumpectomy,
Yeah.
double mastect.
So for
plus
me, it's
ovarian.
Of course, I want to remove all possible chances of
Yeah.
of
I would
it,
think so,
right?
yeah.
So of course, I went for double mastectomy, and I went for the oophorectomy, which is the removal of the ovaries.
Yeah.
The interesting part was the choice of reconstruction or no reconstruction.
I see.
So I thought, I was given options. Actually, reconstruction also got so many options.
Yes, many options.
I never knew that one. But the surgeon kind of narrowed it down.
Yeah,
He claimed that I didn't have enough fat to put here.
Yeah,
lah.
for sure, you don't
so
have enough
he
fat.
claimed that. So because of that, then that option was out. you
Yeah.
know?
So
But
is
if
it
I had,
implant or fat, and what kind of implants? Yeah.
So that option of
Yeah.
fat was out.
Yeah.
Then it came the options of implants, and that part was the part I was actually like really amused because
Yeah.
you know me from school days, right?
Yeah.
In any part of my mind, would I ever consider looking at any form of breast implants?
Yeah, never.
Right?
Never,
right? So it's nothing that but suddenly, right, I was given like this whole tray
Yeah.
of breast implants to like touch lah, feel lah, look
Yeah.
lah, shape lah, size lah, texture, and and whether you want big, small, or whatever. Suddenly I was given this whole array of options,
Oh
right?
my goodness, that was so funny.
It was so funny, right?
Yeah.
But because my cancer was on the deeper level, and because the surgeons were quite confident in kind of like giving me what I call, that means when at the end of the day I can still kind of look and feel the same as before.
Okay.
That's why I decided to choose the breast implants, because worst case, it doesn't work out, then take out, then no more.
Exactly.
Right, but at least I give it a chance first.
You give
right?
it a chance, exactly.
Yeah, and when I look at, I look at myself in the mirror, sometimes I even forget I went for surgery,
Yeah.
Because nowadays
it looks exactly like how you.
I look like I look like before.
Yeah.
And that really.
That's amazing, right?
That is amazing. That's why I would say I'm really, really appreciative of the doctors here who really could.
Actually, I have patients who come to us for breast reconstruction, and I must say, sometimes you may not believe it, but when you look normal or you look better, you actually feel better. Then you actually almost forget that you are a cancer survivor, and it's amazing what things can do. And I think sometimes people maybe outplay the risk. I think everything has risk, but sometimes actually when you can look at yourself and you look normal, that's really a godsend also.
Because then I forget that I ever went for surgery, that is what I am grateful for now. But during that point of having to make all those choices, wow, because you don't know which is the right one.
Yes.
You can only make the best guess, right? Okay. And then go with the...
But that sounds like a lot of surgery. Was everything staged or done together?
All at one time.
Okay. So that's even more amazing, right? It's like you go in, you come out, you don't have the breast, but you have the implants.
Yeah.
Also no more ovaries, right?
No ovaries.
It's like everything done in one shot.
Yeah.
Wow. How long was the surgery?
11 hours.
That is crazy.
Yeah. So no, but I'm glad I went through the whole thing.
Yeah.
Now, of course, during that process, I'll be very worried So I keep asking the doctor, pain or not?
Yeah. Can you imagine this? I always ask this question, pain or not? Even though I'm a doctor.
They will tell me, no not so bad Then I say, I don't believe you, You're just saying it, But until I really did it, then I realized, my recovery, the way I recovered. Actually, I'm very blessed, Charlie. I'm really, really very blessed because the way I recovered, it was really like a very smooth journey.
Really? Did you need any chemo after that?
So that's the thing, So the thing with this whole process, right, was that the treatment plan kept changing.
Oh.
So originally, was lumpectomy, right?
Yeah.
And then some radiotherapy, and that's it. Life goes on very fast, right?
Yes.
Then became double mastectomy, major surgery, take out the ovaries. And then the story was, that's it. After that, you can,
live your life as per normal.
Or go back after the surgical wounds heal. But then at surgery, they took the tumor to the US to do some DNA testing.
Yeah.
And then they come back with some score. I can't remember the exact name of that test.
Right.
They come back with some score.
Okay.
And I'm at the borderline of... so the score was, I think, 26 must do chemo. I'm like 25, something like that.
Okay, so really borderline.
So it's like not near,
not quite aggressive. That's what the score is about, right?
Like aggressiveness. And then also, then they came back with the final pathology.
Yeah.
Then they said the tumor size is 19 mm.
Okay.
Right?
Yeah.
20 mm, you're stage 2.
I see. So you're just at the borderline.
So stage 2 must do chemo. So I'm like 0.1 millimeters. Right? So based on that, I decided to do a prophylactic. And of course, I went to visit, ask a few oncologists.
Because you've already gone so far to prevent cancer by doing a double mastectomy.
And also because I learned from one of my aunts.
Okay.
My aunt had breast cancer. She did, I think, a single mastectomy, but this was a long time ago.
Yes.
But she had recurrence. She didn't have chemo. And then when she had recurrence 17 years later, it came back in the lung, but the cell of origin was breast.
Oh dear, okay.
So, we all know because we medically trained, we kind of know, right? So I just want to just do whatever I can.
Because we have gone so far, might as well do whatever you can.
If it recurs, at least, and I look back, I know that, okay, I did whatever I could.
Yeah.
Okay, and if it wants to come back, then okay,
exactly,
whatever.
but at least you know I've done everything.
Versus I look back and oh, I should have done that at that time.
Yes, yes. But how was chemo? Because all of us, when you're not the one doing chemo, it's always easy to say, oh, it's okay. But when you're the one doing, you're always worried about all the side effects. And the worst is we know all the side effects. So
the chemo one, right?
Yeah.
So this whole journey that I had,
yeah.
It's like, suddenly from overnight minor surgery become double mastectomy,
Yeah,
right?
yeah.
Then no chemo. Then suddenly I got a call from the breast surgeon again.
Oh
Please
my
come
God.
back. And I was like, again. Okay, what is it, right? So I go back.
Yeah.
Then they said, this is your score, you might consider chemo. So okay, I go to the oncologist. So I said, okay. Then they said, oh, but you have to start chemo within, within 3 weeks of your surgery for it to be effective.
I see.
So then we look at the calendar, when is it? Oh, today is like Thursday, must start on Monday.
Oh my goodness.
So we have no time to prepare. It's like no time to go and mentally
sink in and everything, right?
Because all the while was no chemo, right? Then suddenly, it'll come on Monday. We'll start. Then we're like, okay.
Right.
Yeah. But I would say I'm very blessed, Chai-Ling, because I feel that for many years I built up a very good baseline kind of health.
Okay.
And it helped with my surgery recovery, but it also helped with how my body dealt with the chemo. I mean, of course, there are a lot of drugs now that the oncologist can give to help reduce nausea, vomiting, and all these things, right? But I felt that when I went through the chemo process, it was also a very smooth journey because my body was in, I think it was in a good state,
Okay.
to kind of like recover from that.
Okay.
But having said that, I also watched other people around me who are not so fortunate.
I see.
And I could really feel how tough it was for them. And then I realized how lucky I was.
So not many side effects or no side effects?
Very, very minor.
Like nausea, hair dropping, dry skin?
Mainly only hair drop.
Oh, okay. But that grows back.
But the hair will drop lah.
Yeah.
Dry skin a little bit,
but not terrible.
Not terrible, but I was also because I moisturize every day.
Okay.
So maybe that helped.
Maybe that helps. So just to see, what were you doing before this whole cancer diagnosis? Were you very active, fit, healthy? What kind of exercise you do?
I try to be fit.
Yeah.
Okay. I wouldn't say actually I think you're fitter than me, okay? Right, I try to be fit.
Right.
Of course I exercise, but I take care in terms of nutrition.
Okay.
I take a lot of supplements.
Okay.
And I do those things but I've been doing it
like watch your diet
for a long time.
No alcohol or a little bit of alcohol?
I do take alcohol.
Okay.
But after my cancer diagnosis, actually I've reduced quite a lot.
Okay.
I still enjoy alcohol, but reduced a lot. Yeah.
Okay. Because I'm looking at you now, and one thing crosses my mind is I cannot believe you have actually gone through this whole journey. And actually I thought you were going to tell me that your diagnosis was like further back, because you really look like you're in the pink of health. So what did you do after this whole mastectomy and chemo to get back?
What did I do after?
Yeah.
Actually, even before. Okay. So 2 years ago. At this point of time, I think a lot of us have forgotten. It was still COVID.
It was still COVID.
COVID, okay? It was still COVID.
Yeah.
So I had this, like today, 23rd May, right?
Yes.
My surgery was 6th of July. So there was this few weeks,
Wow.
So actually, before that, I was already exercising. But during this period of time, COVID, suddenly everybody says, you don't get COVID.
Okay.
All the doctors told me, please don't get COVID.
Okay.
So please don't get COVID means what? I stay at home lah.
Right. Okay.
Then I was thinking, then they said, but you should exercise also.
Yes.
Because you want to be fit for the surgery.
Yeah.
And then I was told I couldn't do upper body exercise because they didn't want the pectorals to be too tight in case, right?
Yeah.
So then they said, go and brisk walk or jog or whatever lah.
Right.
But then they said I can't go out.
So how?
So every day I brisk walk in my house for 2 hours.
You are kidding me?
I'm not kidding.
How many steps is that? Brisk walk for 2 hours?
Okay, I figure it's at least 10,000 steps. But that's...
You can do 10,000 steps at home?
Yeah, at least that is 7 kilometers,
At home?
Every day, I will just go back and forth, back and forth, back and forth.
Oh my God, it takes a special type of person to do that.
But because I feel that, everybody, even if we were going, it is important to have our body in a good state.
But I think that actually helps because I think,
Yeah.
you know, your health definitely
I mean,
helps.
it not only helped with the physical part, but I think the mental
also.
You know,
Yeah.
that aspect,
Yeah.
the exercise part, and
Yeah.
then the nutrition part,
Yeah.
and
Okay.
even post surgery, post chemo,
Yeah.
I exercise every day.
How soon after chemo can you exercise?
Actually, during chemo, I was exercising.
That's crazy. Again, walking up and down your house and doing 7 kilometers.
Yeah, or I wake up like really early in the morning when there's nobody outside.
Because obviously you don't want to catch any germs because
Because you're still COVID, right?
Yeah.
I'm not supposed to get COVID. So
Yeah.
I would go
Yeah.
and then do like a jog outside.
Oh my God.
And then that time I was still recovering from the
Yeah.
surgical wounds.
Yeah.
But they say can exercise, so I follow those. You know, there's some apps you can follow.
Yes.
But I follow those for prenatal women one. You know.
Ah, okay,
You know, the very low.
Yes, the low impact.
very
You're not
like-
really running
Yeah,
fast.
yeah.
But that actually could be very good exercise, you know.
Yeah. So it's
Yeah.
just very low.
Wow, that's
impact,
crazy.
Yeah.
Well, you are one disciplined person, man. Yeah.
But it's up to me to I mean, nobody can help me except me, right?
Yeah.
For the body, yeah. So
Did you have a lot of family and social support though? I mean, I know it's COVID,
Yeah.
but you know, with
I mean-
friends and family.
Yeah, so that's the thing. It was also COVID, so nobody could visit me. Which, honestly, right, at that point of time when I look back, to me it was actually the best thing ever. Because I really had time to rest.
Yeah.
Really had time to rest, and rather than I have to like
Take care of people's
and
sadness or I
or
know
people
what you mean.
you know?
Yeah.
I had the time to rest.
Yeah.
Then of course everybody. I mean, they showed their support. You know, they called. You know, they showed the support, and I received a lot of fruit baskets to a point whereby I thought my whole fridge was filled with fruit. Right?
Wow.
I could set up a fruit shop. You know.
Wow.
Yeah, but I mean, there were a lot of people who were very generous and you know, very very appreciative. And then of course my colleagues at work. You know, they really supported, like, you know, took care of everything at work. So all those things really helped lah. Yeah.
But talking about work, I know you're quite a workaholic. So how long did you have to take off work? And did that absolutely kill you?
So at that point of time, I don't know whether you know, I've already sold my whole business, my dental group.
Okay.
I was kind of working part-time.
Oh, okay.
And I was lucky enough to just come back. I would say come back with an open date.
I see.
Yeah.
Okay.
So, but initially it wasn't open date. Okay. Initially it was I go lumpectomy. So I calculate. I say by July. Because or August. They said August. August. They said it'll be okay to go back. So I said August. I thought I'm taking quite a good break already.
Yes.
Right. August can go back. Then after I changed to double mastectomy, then they say, I think you should put it to October. So I said okay lah. So I called the October.
Yeah.
And then after that, chemo like chemo. Then chemo 3 months. So I said, I don't know when I'm coming back lah. Just open day lah. Yeah.
So eventually, did you go back within that year or?
No, I went back the following year.
Yeah.
I probably took about 10, 11 months off.
Okay.
Yeah.
Was it a good time off though?
Yeah.
Right.
Yeah, I really enjoyed that.
I think in both our whole lives, we have never taken a 10 to 11 month break, right? So this is like the first time.
You're the workaholic, what?
Oh no! I think you are the workaholic. I think you are the workaholic. So when you went back to work, I mean, you loved it, and so now you're still working part time, or?
I work part time.
Okay.
I work part time.
Yeah.
So of course, I reduce my hours. Take it more easy.
Do you see life differently after this whole diagnosis and this whole journey?
I think I don't know whether it's different, but I would say I cherish moments. I mean, like I cherish like moments like this. Even like I spend time with you now, or like I wouldn't want to postpone moments like with friends, like relationships. I want to maintain time with parents. I kind of do more of that, and then I travel a lot more now. Yeah,
I noticed from your Instagram account that you travel. So it's like the experiences, right? Because this must really wake you up that we all think that dying is for someone else, but it can happen to any of us at any time.
We always think it happens to somebody else.
Yeah,
it won't happen to us one lah. So we kind of procrastinate everything, right?
Yeah.
Because it only happens to other people. That's what we always feel, but no, it's not true.
You know, but I hate to say this, but you know, for somebody who's just, I mean, not just 2 years recovery from cancer, you have very glowing skin. It's even more glowing than me, and I can, and I know you told me you're not even wearing makeup. So like, what are you doing nowadays that is giving you this pink of health because you look okay, you look full of
and I
energy,
feel okay.
you know.
I don't know how to put on makeup, right?
That's very sad.
I don't own any makeup.
Maybe I should delete that part.
Not even a lipstick, you know.
Oh,
yeah.
This is very sad to hear.
But I mean, you know me from school days, right?
I know.
I'm not.
Yeah.
No, but I would say because of it's always health inside out.
Yeah.
The supplements I've been taking for years.
What supplements? Just
you know, I built a new skin business, and I've been taking supplements from New Skin. They have a lot of really, really good supplements.
Okay.
And I use their personal care products and the latest gadgets that I've been using.
Okay.
Have made a big difference.
Oh, really?
Yeah.
Okay, so let's just go supplements. What are the active ingredients in this supplement so that I can roughly go and buy?
It's a whole range.
Oh,
it's a whole range.
Right.
But it's an epigenetic technology. I use a lot of supplements.
Really?
Yeah.
How many tablets do you take a day?
A day,
every
just one
day?
morning, it's 30 over.
Really? 30 tablets?
More than that, I
God.
think if I go and slowly count lah.
Really? Oh,
Yeah, but
okay.
I know what I'm taking.
And you don't know what's inside the
Of
tablet?
course I know what's inside lah.
Okay.
They're all natural ingredients, but they
Okay.
all work for different purposes.
Okay.
Yeah, and they all help with health in a different way.
Do you have examples of some of the ingredients that's inside?
Cordyceps, ginseng,
Okay.
pomegranate,
I
grapeseed
see.
extract.
Okay.
Then your usual multivites.
Okay.
I take lingzi, I take green tea extract.
Wow.
I take probiotics. I take
Wow, you take a lot. Oh
anthocyanins.
my God, I feel like I'm not taking enough. Okay.
No, but I know what's happening.
Right.
And I've been on these for many, many years. Some of these are newer supplements, but I've been on these for more than a decade.
Really?
Yeah.
Okay.
And all the people say, hey, you know, you can take so much, man. Later your liver how, your kidney how. But you know, because of this cancer thing, right?
You have been thoroughly
every
checked.
6 months, right? I got a blood
So the
test,
liver, everything's okay.
and everything is in. Even my cholesterol is optimal,
Wow,
right?
amazing.
Yeah, so important is, good supplements,
Okay.
but I know what I'm taking and I make sure that they are good quality supplements because there are supplements that also do have ingredients which might have some toxicity.
Yeah, and then maybe, you know, whether
Yeah.
they have interactions, yeah.
Yeah.
I take about 5 to 6, but I certainly now feel like I'm not taking enough.
I
So.
take a lot and then I use the gadgets.
What kind of gadgets? Is it one of those handheld, red light
Yeah.
therapy, ultrasound? Oh,
No. I use one that uses galvanic currents.
Okay.
Then another two that use microcurrents.
How often do you do that?
Okay,
Once a
the
day?
galvanic current one is once a week. It's a treatment.
Okay.
Then one that uses alternating microcurrent, I use that daily because that's for radiance.
Oh my God.
You know I play golf, right? Then always
Well, you
in the
don't look
sun,
like you're
right?
playing golf. You definitely
That
don't have
one
the
really helped me with my pigmentation.
Wow.
Then I use the other one. There's a new one which is adaptive microcurrent, but that one is more for wellness for my
see.
body and things like that, and detox.
Okay.
That one actually I found it really, really good for lymphatic flow.
Why? So you're very busy every day, actually.
I'm thinking about myself, right?
Yeah.
So I've been using those,
Okay.
and then I use all the other skincare products.
I see.
Yeah, that's the only thing I
So
use.
every day, all the time, I'm using to put on my makeup. You are using to take supplements and putting
maybe lah.
That's the difference.
Yeah.
Now I know lah. But you know, actually, this is maybe a bit of a sidetrack because I know you mentioned you had your ovaries removed, right? And that's a topic of interest for me because last year I just wrote a book about menopause for my patients. So
I should be your guinea pig. Overnight menopause, you know. Mine is literally overnight
so it's
menopause.
literally overnight because I'm
Yes.
very sure, look at how fit and healthy you were. You were not even close to being in menopause and suddenly when you wake up, the breasts still look the same but no ovaries. Is there any difference? Because you know my patients that are going through like perimenopause, it's a slow decline but they also feel a difference. Did you have symptoms?
So before this surgery, right?
Yeah.
Actually, I don't think I was near menopause yet because I was still very regular with the menstrual cycle, and my sleep patterns were so good. You know, everything was really good. But then the overnight menopause.
Yeah.
So when it first happened, actually, I think my body was a little bit in shock because. Don't forget, I did the double mastectomy that take out ovaries, right?
Yeah.
So actually, after about 2 days, suddenly I had hives appearing.
Oh, okay.
And I was still in hospital at that time.
Yeah.
And all the doctors couldn't figure out why I was having hives. Until finally they decided, I think it's from your instant menopause, which they have seen, it's not common, but it could have been from that.
Yeah.
The highs, but of course I overcome that.
Yeah.
Some people have hot flush, right? They have periodic. Mine is like perpetual.
Yeah.
I'm perpetually hot lah.
Yes.
And then of course I notice changes in sleep pattern.
Don't sleep so well, right?
Yeah, last night I sleep, morning. I mean, I can sleep that good few hours.
Yeah.
Solid,
Yeah.
But now I will wake up.
Yeah.
And I will wake up every sleep cycle because it's so interesting. It can be a 2-hour cycle. That means I can look at my phone and says like 1:03. Then I go back and sleep. Then next time I woke up, I know it's 3:03. And really, it's 3:03. Yeah, really, it's like a 2-hour block.
Right,
it can come either as a 2-hour or 3-hour block. Yeah. But I'm fortunate, but I can still fall back asleep. I know some women cannot fall back asleep.
Yeah. Okay.
And then of course weight gain lah.
Okay. But did all these symptoms, is it still plaguing you now, or it's
better?
Better, okay.
The hot flush, I think I got used to it. I just feel hot all the time.
Yeah.
So I hardly wear any like long sleeve stuff right nowadays.
Okay. Yeah.
And then the sleep, I will wake up, but I will go back to sleep straight away. But I will know the time.
Right?
Yeah, it's rather amazing, that one.
And then the one that most ladies are scared of is the weight gain. So like, how much weight, and did you actually eat more, or you ate the same, or you ate less?
The same.
Ate the same.
So during chemo, after from surgery to chemo, I put on 8 kg.
Because of
I think it's whole host of things
and the stress. Okay.
A whole host of things.
Yeah.
I was placed on some form of steroids, so that some water gain. I was asked to eat well during chemo.
Yeah.
So I really ate, and I think that's also my fault lah, because I anyhow eat, right?
Yeah.
And then of course during chemo I was less active than previously. But I think that was I finished chemo 1.5 years ago.
Okay.
But 1.5 years later, then of course the body has settled. But I noticed that it's harder to lose the abdominal fat.
Yes, for sure. Yeah.
Yeah.
It's a hormonal kind of thing.
It's a lot harder. I have to work a lot harder. That means watch my diet a lot more. I have to be a lot more active for the same result as last time, Yeah. So that one is
How
apparent.
much weight then now compared to pre-surgery? What's your weight difference, if you don't mind us asking?
Maybe now to pre-surgery.
Yeah, before you took up the ovaries.
It's about, I think I still got another 3 kg before.
That's not so bad, 3 kg is still
because I
not so
cut
bad.
down.
Oh, so you actually went
I've been going down.
Okay.
I'm on the way down.
Okay.
Yeah.
So what can you tell all of us plus the audience, what are you doing to cut down, and what were you at the peak? That means like,
it was so
you have gained how
horrible.
much, and then now it's only left 3.
I was nearly 70 kilograms.
That's a lot for you, because you have never been big size. You've always been on the skinny side.
Yeah. So very big. Okay, so I go on a program with New Skin.
Okay.
And it's a really responsible program. So of course there's some supplements to help.
Okay. More supplements. That's why the
supplements to help. But also I eat properly. I never skip meals.
Properly?
So every meal I will have vegetables, fruit, protein and carb. And I make sure I have good lean protein every meal.
But the carbs, you don't try to limit it, because you said it's hard to...
Yeah, a portion.
Okay.
I watch portion sizing.
Okay.
But I never...
How do you all watch portion sizing? Do they give you a plate, or you have to weigh everything? Because
roughly
like palm of the hand. Because it's so hard
hand.
for me to weigh when I'm at work.
Roughly from the palm lah.
Okay, so like
so if like,
how much protein,
like some
how
guys,
much
they will have a much bigger hand, then they can eat a lot more.
Really?
Yeah.
Oh dear. Okay.
Yeah, because
then Yanni will eat nothing because she has such small hands.
Yeah, too bad lah.
Too bad lah. Okay.
I mean, her physique is so much smaller, ma.
I see. Okay, so
right.
just roughly, that's a good guide. I like something
so
that
vegetable,
we can.
So I will eat. If it's salad, it must be this portion.
Oh dear, I don't think I eat.
It must open.
I don't.
Bigger.
Like
salad.
That.
Salad.
No. My salad is like that. My beef is like that. So I'm eating too much beef.
But because you are working out and you are really working out, you will actually need that amount of protein.
Okay.
Of course, if you don't work out, then eat so much, then it's going to go somewhere, right?
Yes.
But the lean protein is so important.
How much lean protein? Can you show me?
In general, okay, depending on what the person is looking for.
Yeah.
I'm looking to cut.
Yeah. So for you,
So I'm looking at every meal. I at least have fist size.
Let me see. Will I be full with that size chicken? Right?
Yeah, but
maybe. But every meal, right? Not the whole day.
But then don't forget my vegetables.
Like that.
Yeah.
And then
and then the carbs.
Very little
right?
carbs.
And I also take, after that, I do add on maybe a tofu.
Okay. So a bit more protein.
A bit of egg, egg white. Or
so you're
things
not
like
starving, you're not hungry, you're not really cutting calories, you are just looking at the macronutrients.
Yeah, you're not supposed to starve because you starve, you store, right?
Yeah.
Yeah, the more you starve, you store, and then your metabolism just goes down.
Yeah, because when you starve your metabolism, that's what I always tell my patients, you will lose initially, but it can be water weight, then your metabolism falls, and then you're going to equilibrate at a lower metabolism, which means that you're going to eat nothing but don't lose weight. That's the worst.
Yeah. With this menopause, of course, it's been tougher, and it doesn't help that I'm on tamoxifen.
Yeah.
The tamoxifen makes it even harder. Tamoxifen is a drug, right?
But you've done very well. You only left 3 kg from 8 kg, so whatever you're doing, despite the tamoxifen, must be working.
But it takes longer to achieve what. But you know, health is never a destination. Health is always like, it's a journey that we keep maintaining. It's not like I hit this, then that's it, right?
Yes.
It's a long-term maintenance, and when I eat better, I feel better.
That's true.
And when my body is fitter, I also generally feel better. You know, and then you also sleep better. You don't feel so tired.
How about alcohol, though? What are your thoughts? Like, you know, some of my patients, they have gone through this whole breast cancer journey, and they're coming back, and you know. What are your thoughts? No alcohol, or live a little bit of alcohol?
I say live a bit lah.
So you still drink from time to time? No problem. Okay.
Yeah. But I don't go overboard.
Yeah, no more binge drinking for sure.
Yeah, but having said that, during Christmas last year, you know, that whole November, December festive season, right? So every other day there was like you know, some party lah, whatever. Okay. And I noticed that even though maybe I just took a glass every other day, it really suddenly I could see my body going boom again.
The impact on the weight.
The impact on the weight was like, you know. Then I was like, oh, okay. These empty calories. I realized that impact it had on me versus previously, when I could do this, like I can maybe just drink one drink and not not drink half a bottle or something. And it was fine, you know.
Yes.
But now, so I learned how to manage, but I can enjoy.
You can still enjoy from time to time.
Yeah, like I can still go to the omakase and still have some wine pairing.
Yeah.
I might not drink all, you know.
Okay.
But I don't do this
all the time.
Yeah, like I haven't had alcohol maybe for a month or more.
Okay, so that's very little.
Yeah.
But you play golf every week now. That's your exercise.
No lah, golf is not considered exercise lah.
Oh really? Okay, golf is okay.
Golf
okay,
is,
that's okay. Now we know golf is not exercise.
I mean, what do? You just walk. But
at least it's something you enjoy.
Yeah, it's something I enjoy. What do you call it's very fulfilling because it's very. I'm competitive type, right?
Yes, you're very competitive. You're probably a very good golfer, right?
No lah, I think there are a lot of very good golfers. But at least the person I'm competing with is myself.
Okay.
And there's a lot of things to improve there.
Yeah.
But in terms of workout, I do a lot more strength training now because I need to build lean muscle.
So you go to a gym and you do weights?
I never go gym. I do in my house.
Okay.
But I have the weights and I have to discipline myself. I follow an app.
Okay.
And I discipline myself to must follow lah.
I know you will definitely follow and probably do extra.
I don't. Okay, when I mean I have to follow lah, and then of course interspersed with some cardio. Okay. But I focus a lot more on strength training because I was told the tamoxifen can put me at risk of osteoporosis.
Yeah. And also for menopause, you know, if you get hit menopause, you lose muscle. Yeah. Is that every day or like 3 times a week? Is there a regime for your strength training and your cardio?
I put 2:1 ratio.
Okay.
2 days of strength to 1 day is to cardio.
So it's every day. Every day you're doing something.
I mean, there's actually a day of rest in the app, based on the app, right? Because the app is like you do this today, do this, and today you follow this. You work on a certain group of muscles. The next day, actually, you're resting that group of muscles, but you're using a different set of muscles.
Oh,
so that's why
if you don't mind me asking, what is the name of this app? Is it free? Is it paid or?
Paid app. It's I follow. You know the Biggest Loser, Jillian Michaels?
Okay.
She has an app.
Okay.
Yeah, and then there's so many different workouts there. And then she will have those like low. I mean, for for people with different fitness level.
Okay.
Then instead of jumping jacks, then the person just like tap the foot out.
Oh, okay,
if you're not so fit yet, you can start with that, right?
Yeah.
But
that's a very good thing. You actually do everything at home. You make it very easy. That's why you can follow it rather than have to sign up for classes, which
No, because I know me. If I have to wake up, I have to drive to
the chances get very low, right?
Then if it's raining or what, but
Yeah.
now raining or what, rain or shine, because it's in my
No
house,
excuse.
right? I just have to do it.
Yeah.
If I can walk 7 kilometers to my house,
that is crazy, I don't know how anybody can. Either your house is very big or you are just very.
It's very small. But I was inspired by during COVID, whether you read, those people in quarantine. Then there was these 2 guys who ran a marathon in their hotel room.
Really?
Yes, I was inspired by that.
There were guys who ran a marathon in the hotel room?
They were, during the quarantine.
It's crazy. Okay, so you see, just if we are motivated, anything can be done. Yeah. I want to ask, you are taking supplements after you remove your ovaries. Did any of the supplements help with the menopause? Because, some people believe that some supplements can actually help with the menopausal symptoms. Did you take any supplements that help with menopausal symptoms?
They weren't specific for menopausal symptoms.
Okay.
I still had the menopausal symptoms, but maybe less.
Maybe.
I can't really say for sure.
Yeah.
Because before that, I was taking the supplements. After that, I still take the same thing.
Yeah.
Right?
Wow, I see. So no change lah. Your supplements is more for general health, not specific.
Yes, not specific.
Yeah.
But I would say that I feel it's not so bad for me as compared to I've seen some other of my friends with really a lot of fatigue, a lot of weight gain,
Are you a religious person, I think?
No.
Probably no, right? I think we all did Confucius studies, right? Because we had no religion.
No, I think Buddhist studies.
Oh, you did Buddhist? I did Confucius. Even more so I thought maybe, so no, not religious. So how did you get through this whole, emotionally? Physically you're in the pink of health, but did you feel like emotionally you needed support when you go through all this whole diagnosis? Okay. Did you get into depression?
I can see why people can get into it, because it's very easy for the mind to wander into all kinds of... your mind is very easy to wander, right?
Especially at night, alone, sleeping.
Why is this lah? Why? Or like the worst thing you can ask yourself is why me? Okay. Yeah. There's no answer for that, right?
Yeah.
I knew that. I can see where that was. I sometimes, if I knew that I was going down that road, I would catch myself, and then I will go back to what usually has been able to get me through like tough times.
Okay.
What I usually do is, whenever I have faced something challenging, the first thing I will do is I will find something to be grateful for.
Okay.
From that gratitude lah.
Yeah.
So like my cancer diagnosis, actually why I'm so grateful, because I found it early.
Yeah.
Actually, I think very lucky already, because if I didn't find out, like today, 2 years later, the story is different,
Exactly.
Right?
Yeah.
So that one. So then
find something good about it, even if it's a terrible situation. Yes. Think of something good. Okay.
To be grateful for. And then I'm grateful that I'm in Singapore. I'm grateful to have very good friends who were helping me with the treatment. I got very grateful for the family support, my friends, the people around me.
Yeah. And grateful that you sold your business, so you have the luxury of actually recovering.
Yeah, and the position I was in. So the gratitude, I go for gratitude first. Then the next thing that I would do is I would ask myself to focus on what I can control.
Okay.
And for whatever I cannot control, is to leave it. What could I control?
Yeah.
I could control how I deal with the situation.
Yeah.
Right? My attitude towards it.
Yeah.
How I want to approach it, or like where I could get help. So actually, I would focus on controlling my thoughts, my emotions, right? To control them towards on the more positive side.
Yeah.
Because I can also just let it go to the other side, right?
Yeah.
So don't go down that rabbit hole.
Yeah. So don't let your thoughts control you, but you control your thoughts. Okay.
Because I can control that, right?
Yeah.
And I choose to be in a happier position, because no matter what, already got cancer, what?
Yeah.
With or without cancer.
Yeah.
Already got, right?
Yeah.
Then you sad also got cancer, you happy also got cancer, then you choose happy also is better than choose sad, right?
Yeah, it's true.
You might as well be happy lah.
Yeah.
Actually, you find that the whole process, I don't know whether it's a mental, physical thing, but the body responds in that positive way too,
Yeah. Maybe that's why you had not as many side effects with chemo, because yes, you were healthy, but I also know a lot of healthy people that actually suffered quite a bit. It could be a mental state thing as well.
Yeah. And then to make humor out of
Yeah.
the whole situation lah. Like I remember laughing non-stop, trying the breast implants, stand in front of the mirror and laugh and laugh and laugh, and then nowadays they have those software,
Yeah, to simulate.
Yes, like
exactly.
if you put this one, right, you will look like this. Then you put this one, you look like this. So it's so funny, right?
I know.
Yeah, I never imagined ever having to go through that, but when I had to go through that, I mean, it was
never say never.
Yeah,
That's why.
Yeah.
So if let's say we have listeners out there that are also going through the same journey, what is one piece of advice you can give them to help them go through the same journey? Some of them are just diagnosed, some of them are going through treatment, and of course there's some that is worried about recurrence. It changes your life.
I mean, most people would tell you to be positive, right?
Yeah.
But all those advice aside, I think everybody with breast cancer, majority of them are women who are doing so many things.
Yes.
They are the mom, they are the daughter, they are the wife, they are the everything, and they got so many things, right?
Yeah.
And they never take care of themselves.
Yeah.
So I would say, right, during this period, this is your period to prioritize yourself.
Yeah.
You really have to prioritize yourself. It's not about whether your kid is going to the ballet or the, I know maybe your kid got PSLE or, but you have to prioritize yourself. When you're able to do that and recover well, then you will be actually directly taking care of your family.
Yeah.
But if you cannot do that and you kind of like let yourself sacrifice yourself for the rest, right? And don't take care of yourself.
Yeah.
Your health might not recover so well. In the long run, you yourself and your loved ones also will suffer more.
Yeah.
My personal perception, our opinion.
Yeah. Because I've seen you, considering you work just upstairs from me, I've seen you before cancer, and then I didn't see you for a while, and I see you now, and I actually think you look better now than before.
Because less stress.
Maybe it's this, we think so many things are so important, and now that we cut away all these things that are actually not important, then, your whole mindset is also freer.
By taking good care of myself.
Yeah.
Actually, in that way, right, I have actually managed to take care of my parents.
People around you.
My people around me, because they worry less.
Yeah.
And actually, I can be more for them now than if I were not able to recover,
Well, thank you very much. I think it's such an interesting conversation. Yeah, and I'm very sure that our listeners will have learned a lot from this. Thank you.
Thank you, Charlene. Thanks for having me.
Thank you. Thank you, Ying Keat, for sharing your incredible journey with us today. Your story of resilience, courage, and triumph over breast cancer is truly inspiring and offers hope and encouragement to so many. We are grateful for the insights you have provided and the strength you have shown. To our listeners, thank you for tuning in to this episode of A Journey of Triumph. If you found Dr. Lam's story as inspiring as we did, please like, subscribe, and share this podcast with others who may benefit from these powerful stories. Your support helps us continue to bring you your stories of hope and empowerment. Until next time, I'm Dr. Loh Chai Ling, reminding you to stay young, stay hopeful, and continue your journey of triumph.